Good afternoon, everyone, and thank you for joining us here for this exciting announcement on the next milestone in our fight against COVID-19. I want to thank my colleague, Audrey Gordon, the Minister of Health and Seniors Care and the Minister for Mental Health, Wellness and Recovery, and Dr. Joss Reimer, Medical Lead of our Vaccine Implementation Task Force, for joining me here today. As a government, our number one priority is protecting the health and well-being of all Manitobans. Nearly 1 year ago, Manitoba administered its first dose of the COVID-19 vaccine. I remember that day vividly and the hope I felt for a safer future for our people in our province. Since then, we have administered over 2.1 million doses, representing nearly 85% of all eligible Manitobans who are fully vaccinated. That is an incredible accomplishment, and I want to thank each and every single Manitoban who has rolled up their sleeve to protect themselves, their loved ones, and their community. As we eagerly await approval of the pediatric COVID-19 vaccine, we are here today to tell you that Manitoba is ready to implement the next phase of our vaccine campaign to protect our children ages 5 to 11. As a mother of two, nothing matters more than the health and safety of my children. As parents, we want to give our children every opportunity to learn, create, play, and chase their dreams. As we prepare for this next milestone in our fight against COVID-19, our government is dedicated to supporting guardians who will soon be faced with making the important decision with their children to get fully vaccinated. Vaccines are the way out of this pandemic. They are how we keep our schools, our businesses, and places of worship open. And most importantly, they help keep our hospitals and communities safe. With that, I'd like to ask my colleague, Minister Gordon, to expand on the next phase of Manitoba's vaccine plan.
Thank you, Madam Premier. Good afternoon, everyone. As the COVID-19 pandemic wears on, anytime there's an opportunity to renew our optimism in this fight to protect all Manitobans, we need to take it. We're getting very close to reaching a new milestone, one that will mean all children in Manitoba aged 5 to 11 will have the chance to be protected from COVID-19 through immunization. The latest update is that Health Canada is nearing its final stages of the clinical review of the Pfizer vaccine for children in this age group. We are anticipating that Health Canada may soon have an announcement to make. When Health Canada announces its approval of the vaccine for children aged 5 to 11, this approval would be followed by a recommendation by the National Advisory Council on Immunization. When these announcements come, we will absolutely be ready to protect Manitoba kids through the immunization campaign. We are poised to launch the most robust and coordinated immunization effort in the province's history to protect younger children, and we are mobilizing province-wide to help make communities safer. The time is now to start having family conversations about how vaccination works and about how it helps keep people safe and healthy if you have young children in your home or if you care for young children. The approval of the pediatric vaccine would mean that we can all get closer to seeing the end to this pandemic. The first doses of the pediatric version of the Pfizer vaccine would be expected to be available in Manitoba as early as a week after the vaccine is approved. We are assured that there would be ample supply arriving in the province. At that point, the vaccine would be offered through provincial and regional vaccine clinics, physicians' offices, pharmacies, urban Indigenous clinics, and pop-up community clinics. Walk-ins would also be an option at some locations, and in schools, vaccination would be offered both during and after school hours. We want to be able to meet parents and families where they're at, to reduce barriers to access the vaccine, to make access simple and convenient. To support the campaign, our government has put a policy change in place so that pharmacists will be allowed to immunize all children in this age group. So they will also be able to vaccinate children in this age group, not just for COVID, but also for influenza, when, of course, the vaccine is available and approved. Previously, pharmacists could only vaccinate children aged 7 or older. We know that COVID cases are rising in Manitoba, and children make up many of those cases. The risk of infection is highest for these children, especially in those communities where vaccine coverage rates are lower than other places in our province. In the 21-22 school year, 13 school outbreaks in children ages 5 to 11 have resulted in a move to remote learning. More than 6,000 children aged 5 to 11 have been tested positive for COVID-19 in Manitoba throughout this pandemic. 27 children have been hospitalized with COVID-19, and 7 of those were admitted to the ICU. One child has tragically lost their life to COVID-19. Although children and youth are less likely than adults to get critically ill from COVID-19, they can still get sick, spread the virus to others at school and in the community, and experience long-term negative health outcomes from the virus. Earlier this fall, the province conducted a survey of parents to better understand their perspectives on COVID-19 immunizations for children. We're sharing those findings online. It showed that parents who are vaccinated will most likely ensure their children get immunized too. Considering that 85% of Manitoba's adult population is vaccinated, the survey suggests that a high percentage of child immunizations is likely. This is really, really good news. A majority of parents who participated in the survey also said they would most likely visit a healthcare professional, vaccine clinic, or pharmacy for their child's immunization. The survey results also confirm that most people, whether immunized or not, trust their friends and family's advice, making it important that parents and caregivers have access to factual information about vaccination so they can share it with people they care about most. This is why we will soon be launching Protect MB Kids campaign. Our goal with Protect MB Kids is to fully support families in this important decision. So I hope you will stay tuned and visit the Protect MB website in the days and weeks to come. It will include colorful resources, information, and shareable content for parents. We'll talk about vaccine safety and availability. But we haven't forgotten the kids. We'll talk about how to make their vaccine day a positive experience, and they will get a special sticker too. Our province's children have gone through many challenges during this pandemic. The sooner that all eligible Manitobans are fully immunized, the sooner we can all feel safer, better protected, and more able to freely enjoy our regular lifestyles at work, school, and in our communities. If you are a parent or guardian of a child, I encourage you to be proactive and talk with your primary health care provider, pediatrician, or by visiting protectmb.ca. You will find answers to questions about immunizing children against COVID-19. With that, I'll turn things over to Dr. Reimer.
Thank you, Minister Gordon. And good afternoon, everyone. I'm Dr. Joss Reimer, medical lead for the Vaccine Implementation Task Force. As we develop our plans for what the vaccine campaign will look like for 5 to 11-year-olds, I wanted to take this opportunity to talk more about the vaccine for children aged 5 to 11, the scientific review process, and if approved, how the vaccine would work to protect Manitoba kids from the COVID-19 virus. The Pfizer vaccine was the first COVID-19 vaccine available in Canada. And for that reason, more Canadians and more Manitobans have received that vaccine than any of the other vaccines available. It's an mRNA vaccine or messenger RNA vaccine, and it teaches the body's cells how to make a protein that will trigger an immune response. The vaccine does this without using any part of the actual virus that causes COVID-19. Once the immune system is triggered, the body makes an army of virus-fighting antibodies, which provide protection from being infected when the real enters the body. I want to repeat the same message that I've shared when talking about this vaccine and about all the vaccines that we have available. The vaccine cannot give your child COVID-19. It cannot change your child's DNA. mRNA technology is well understood, studied, and has been found to be safe. In fact, messenger RNA is something that our bodies use naturally all the time to produce the proteins that we need to live. The only difference this time is that the messenger RNA comes from an outside source. So let's talk a bit more about safety. Prior to approving a vaccine for use in humans, Health Canada conducts a rigorous scientific review of medical evidence. In the case of the Pfizer vaccine for adults and for youth, aged 12 to 17, clinical trial data was analyzed to assess the safety of the vaccine before it was approved. As I've talked about before, no steps are skipped in this process. What does happen is that Health Canada is reviewing the data in real time instead of waiting for all of the findings to be submitted at the end. And this helps their review to occur a lot faster when submission occurs. The same is true for the pediatric vaccine. If Health Canada does not identify any major safety concerns and finds that the vaccine is effective, they are expected to approve the vaccine. But they will also continue to monitor and evaluate data even after its approval. If Health Canada approves the vaccine for use in younger children, and we anticipate that they will, the National Advisory Committee on Immunization, or NACI, will also come forward with its own recommendations on how this vaccine should be used in Canada, and they'll provide detailed clinical guidance of the vaccine. In the time that Pfizer has been available overall, we have seen that it is extremely reliable, safe, and effective. No vaccine can be 100% effective, but it does give very high levels of protection, preventing severe outcomes extremely well. Clinical trials are ongoing to monitor, detect, and respond to potential safety signals that may arise, including myocarditis or pericarditis, which is swelling of the heart muscle or swelling of the lining around the heart. Those rare reports following immunization in teens and young men have not been detected to date with the Pfizer pediatric vaccine. And so we're hopeful that that will continue to be the case. This might be due to the fact that this vaccine is a lower dose, or perhaps it's due to something like different hormone levels that occur in younger children. But regardless of the reason, we will be watching very carefully, and I will update Manitobans if we see cases in this age group. Even with older youth and young adults, the cases have shown to be mild, and almost all of the individuals who experience myocarditis have returned to normal very quickly. We know that COVID-19 is affecting Manitoba kids, and we want to protect them with every tool we have available. While it is true that most children who do get COVID-19 will have mild or sometimes even no symptoms, some children are more vulnerable. Some children have to undergo treatment in the hospital or even the ICU. As the minister noted, almost 1/3 of all COVID-19 cases in this province over the past few months have been among children who haven't had the opportunity to be immunized yet. School cases continue to follow the same patterns of cases in the community. And most of the cases are acquired in the community, not in the schools. As we've said, the 12 to 17-year-old provincial vaccination rate is 78%. Based on the results of a survey of 800 parents, 75% of Manitoba parents plan to vaccinate their 5 to 11-year-olds. So we do expect a similar uptake amongst 5 to 11-year-olds when the vaccine is approved. With positive news on the horizon about the availability of a pediatric vaccine, we hope to have a much better chance to keep all our kids healthy, to keep them away from the hospital, to prevent them from having long symptoms related from COVID, and to keep them happily in their active daily lives in school, with friends, with family. I know that parents often have many questions about healthcare interventions when it comes to their children. This vaccine is no different. I'd like to talk about some of those questions and some of the concerns that parents or caregivers might have. So, for example, is this vaccine exactly the same as the adult Pfizer vaccine? While the content of the vaccine itself is going to be the same, made in the same way, the dose will be different. The pediatric version of Pfizer will be 1/3 of the dose that's used for older youth and adults. And this is a common practice in vaccines for younger children. It will be given to your child the same way as you received your COVID vaccine, as an injection into the shoulder muscle. The vaccine should be a good option for all children, except those who have had a severe allergic reaction to a previous dose of the vaccine or to any ingredient in the vaccine. Most of them will still be able to receive the vaccine, but would benefit from the review of their situation by an allergist. We also expect that your child will need 2 doses to be considered fully vaccinated and to have the fullest protection against the virus. We will provide clinical guidance on what the minimum timeframe will be between doses, and we will advise Manitobans about that after we review the recommendations that come from NACI. The minister has gone through some of the details on how parents and caregivers will be able to access the vaccine. If the vaccine is approved and recommended by NACI, I will encourage all parents and guardians of children aged 5 to 11 to take steps quickly to get your child immunized. As Minister Gordon noted, your family's healthcare providers, pediatricians, pharmacists, family doctors can answer your questions. Our website also has a lot of helpful information and resources to make your vaccination decision for your child a more confident one. We will be adding more resources in the coming days to weeks. And when the time comes, there will be many convenient locations open to you. The province's vaccine finder map can help you find a convenient location close to where you live or where your child spends time, so that your child can be vaccinated in a way that is most convenient for your family. With that, I will pass things over to Premier Stephenson to wrap things up.
Thank you very much, Dr. Reimer, and thank you for your compassion, your leadership, and your tireless effort throughout this pandemic. It's great to be working with you again. I would also like to take this opportunity to thank all of our healthcare staff, doctors, nurses, healthcare aides, hospital and support staff for your hard work, dedication, and selflessness throughout this entire pandemic, and especially now as we face the challenges posed by the 4th wave. I also want to commend our teachers, administrators, and education support staff for all you do to keep our children safe. COVID-19 has challenged us in many ways, and I thank you for your willingness to adapt and find creative ways to keep our children engaged and able to reach their full potential. We all want our children to be able to attend school and participate in their normal social activities, and achieving high vaccination rates in both adults and children will be key in controlling the spread of the virus and ensuring that can continue to happen. I encourage all Manitobans to be proactive and talk with your healthcare provider, pediatrician, or visit protectmb.ca for answers to questions about immunizing children against COVID-19. Again, I want to stress with all of you today, as we await the approval of the pediatric vaccine, I want to assure you that Manitoba will be ready to quickly implement the next phase of our vaccine campaign to protect our children ages 5 to 11 from COVID-19. And thank you, and we'd be happy to take any questions that you may have.
Dr. Reimer, you talked about NACI, they'll be having their own recommendations about this. How much have you guys consulted with NACI to this point about the plan? And are you expecting there to be big changes to what you may have to do coming out of any kind of approval? Or is this pretty confident in what we have now? That's how it's going to look even after NACI comes out with their federal recommendations.
NACI has a rigorous internal process that they use to evaluate all data that is available to them and to Health Canada. We don't have the opportunity to see the data until after the Health Canada approval occurs. However, what we have seen from the American submission to the FDA was quite reassuring and did show that this was a beneficial vaccine for children in the United States. And so I don't anticipate any major changes regarding the vaccine for this age group, apart from the different dose and the possibility of a different interval between dose 1 and dose 2. But we really will have to wait for NACI's recommendations before we finalize Manitoba's approach in regards to that.
Dr. Reimer, in the technical briefing today, there was no discussion on how the province would target communities that have high ongoing infection rates or barriers to health services. Why isn't that a focus of the vaccine rollout for kids in the way that it was for adults?
So we're going to be using many different tools and different locations and different types of vaccine clinics to reach as many people as possible. Both to make it convenient for them, regardless of where they live in the province, to be able to get the vaccine, but also to make sure that people have access to convenient and easy to understand information. So we plan to, rather than target one location over another, to have a widespread start to the vaccine campaign. When we started with adults almost a year ago now, we had very few locations where adults could go to get their vaccine. But that's not the case any longer. And we have a much broader opportunity to have convenient options available to Manitobans in all parts of the province. So we're excited to be able to roll it out in pharmacies, in physician clinics, whether that's family physicians or pediatricians, our vaccine clinics, the urban Indigenous clinics in First Nations communities, and then eventually in schools as well. So we'll be doing all of those things, as well as working on communication to make sure that parents and caregivers have the information they need to make those decisions.
What do you think the earliest date is for a child age 5 to 11 to be vaccinated in Manitoba?
Well, it's hard to know exactly when the vaccine will be available. We have been told that we can anticipate that the vaccine will be showing up to Manitoba within about a week after approval occurs, and we will start distribution once we receive it here. So we had been planning for early December as a realistic timeline, but certainly if Health Canada approves things sooner, we will be ready to go sooner as well, and look forward to having that vaccine available as soon as we have it in the province and can ship it out to all of those locations. And it would be wonderful if that was in November.
I don't know if this is best aimed at Dr. Reimer or somebody else, but given the feedback that we saw today in the technical briefing about people's opinions and who they trust to get their information from, journalists were low on the score along with some other people, politicians. Is that shaping the messaging and the campaign in any way?
You know, it's really important that we have consistent messages between many different trusted providers. For example, I know Doctors Manitoba has done a lot of great work on getting consistent messaging out to all there, as well as to the public. So they have a website, they've been doing some social media outreach as well. So that's just one example of how we want the government, we want public health, we want healthcare providers, pharmacists, Pharmacists Manitoba, for example, all having access to the same important information so that they can be that trusted source of information to families, whoever they see as the most trusted person for them.
And just to follow up on Steve's question, I have a question for Mr. Gordon. Mr. Gordon, you told the CBC that your department is rolling out communications materials in Southern Health to help with vaccine uptake. And when we asked your department, we were told that you're coaching doctors to speak with patients. But are there any materials, printed materials, ads, or any other communication materials that are being put forward for Southern Health?
So we are rolling out materials every day. You know, we'll be rolling out materials as it relates to the 5 to 11 immunization. So the physicians and the pharmacists that are working on the ground in Southern Health, I'm sure they have specific materials that they refer to. Perhaps they've developed some scripts that they use when they're talking with individuals that are vaccine hesitant or testing hesitant. So we have looked to them to design what they feel needs to be used for their client groups.
And you've talked a lot about compassion and kindness being the way out of this. I mean, has that worked? I mean, some areas don't show any evidence of there being more uptake as a result of, being more of an approach with a carrot as opposed to a stick. I don't know, is there anything that you can comment about how effective that's been as a strategy so far?
Well, we have our broad restrictions that are helping to keep Manitobans safe by requiring the vaccination card. And I recently, with Dr. Roussin, announced new restrictions that are helping, I believe, to curb that congregate and large volumes of individuals coming together. And I still believe that compassion and understanding and kindness is the foundation of the work that we do with the individuals that are vaccine hesitant and testing hesitant. And we will continue to reach out through the program that you mentioned that we have underway with pharmacists and family physicians and Doctors Manitoba to reach one client at a time. Last year, we were working more with large volumes, as Dr. Reimer mentioned, and now it's down to possibly an individual or a family. And what the results showed from our survey for 5 to 11s is still that individuals tend to change their minds and their decision about the vaccine by talking with family and friends, their pharmacists, their physician. And so we're going to continue, even if it's one person, to increase our vaccination rates.
Dr. Reimer, do you anticipate that the greatest volume of pediatric doses will be going through the regional and provincial clinics, or do you see that primarily being handled by physicians and pharmacists?
I think we're going to see a much bigger division than we had with adult doses, where a larger proportion occurs in pharmacies and physician clinics. It's hard to know exactly what that the exact proportion will be, because it's really about what makes the most sense for each individual family, and we'll have to wait and see how Manitobans make that decision and what turns out to be the most convenient for them. But we will have a lot more doses available through those channels than we had with some of the previous times where we were vaccinating a lot of new individuals. So it's certainly something we're eager to see, and we want to move towards that going forward as well. We have great relationships between Manitobans and their primary care providers, their pediatricians, their pharmacists, and we want to encourage the continuation of those relationships when it comes to these vaccines as well. And we're hopeful that as we move forward, that will become a more and more important place for people to get those vaccines, along with the public health locations, particularly in rural Manitoba, where the physicians and pharmacies are sometimes not the main provider of vaccines, even outside of the pandemic.
So is the planning today that there will be a greater proportion done in the provincial and regional clinics? Is that the plan as it stands today?
It's going to be different in each region. We anticipate in Winnipeg that there will be a large proportion occurring in pharmacies and physician clinics. In rural areas, however, we do expect the majority of doses will probably still occur in public health run vaccine clinics. And that's consistent with what we see for other vaccines as well. In Winnipeg, most people get their annual influenza vaccine at a physician clinic or a pharmacy. But outside of Winnipeg, the public health run clinics are a more common location for people to receive that vaccine. And we are trying to leverage our existing infrastructure, our knowledge, our relationships to be able to transition to a bit more of a normal vaccine program when it comes to COVID as well.
Premier, we hear a lot of reports from Southern Health that enforcement is a problem, enforcement of proof of vaccination in some of the public places where it's required. Are you picking up on any of that, and do you have any plans to improve enforcement in Southern Health?
Yeah, obviously, as we, as Dr. Rusin and Minister Gordon have been going out and making some changes in some of those areas, I think it's very important that we do have the adequate, resources there to ensure that enforcement, that these rules are enforced. So I am hearing that a little bit, and obviously, I think we need to put some emphasis on that as well, and ensure that we are enforcing these rules.
Are there any plans to increase resources for that, or to
Yeah, I
increase-
think certainly I will talk to our Minister of Justice about that. I do believe that we need to ensure that we do have the resources there to adequately enforce these rules, though. So we'll look to whether or not it's having to redeploy or what that looks like. I think that we need to ensure that as rules are changing, that we have the necessary and adequate enforcement in place to do so.
This question is for both the Premier and the Minister. So Southern Health is facing some pretty severe staffing challenges with a couple of facilities in outbreaks, and then almost 100 staff on unpaid leave related to the vaccine mandate. So at what point do we need to bring in external help like the Red Cross or perhaps the Canadian Armed Forces to ensure that non-COVID care can continue in this region?
So thank you for the question. We actually have a incident command table, and we are meeting regularly with the CEO of Southern Health and the facility leads, and we're looking at the staffing challenges. And what we've decided is, and we've implemented already, is a provincial approach to a local issue. So where we see the need for nurses, we are redeploying across several regions to ensure that the supports that Southern Health needs is there, and continue to have those discussions all the time because the numbers are changing. Each region has unique challenges. It's not just Southern. Each region has the unique challenges, so we are moving staff around. We have been very fortunate to have volunteers come forward, even from the community, to support in some capacities, as well as internationally educated nurses that are taking on positions in healthcare aid roles and learning right in the facility for when they will eventually join us in our health system. So we are always looking at what the needs are across the entire province, including Southern Regional Health.
And do you anticipate, so this comes back to a question of continuing non-COVID care and ensuring that resources are available to get through the surgical and diagnostic backlog. So again, if we redeploy, are we not just putting a burden elsewhere in this system?
Well, when we redeploy, we're trying to level the term we use in the health system is level load. So we are attempting to ensure that services are there for COVID and non-COVID care. So, for example, our internationally educated nurses, they may have been in the theory program and not actually working in the system yet, but we have an opportunity to utilize that complement of internationally educated nurses within Southern Health. So we're certainly not compromising care, non-COVID care. We are ensuring that care is provided equally and equitably across the region. So some may have less pressures, and we're able to help our sister or brother health authority, and so that is what we've been focusing on. It's been working very well.
So hearing that here, and then we'll jump to the phones, okay, guys?
Thank you.
And then we'll come back.
Hearing that we're just potentially weeks away from approving this vaccine for children, for the keener parents, as the province has been calling them, can they start booking appointments for their kids? Because I'm sure they're kind of chomping at the bit to get something in for their kids.
So the purpose of, well, maybe I should have Dr. Reimer. Go ahead, Dr. Reimer.
Sure, yeah. So we don't have the option for them to book at this time, but we are reserving appointments. So when the time comes that the approval comes through, we will have open appointments that were saved for this age group. Because we don't know exactly when to expect the approval to happen or when exactly the doses arrive in Manitoba, we don't want to book children and then have to cancel those appointments if the vaccine takes longer than we expect to arrive in the province. But certainly we're making sure that there will be appointments available when families want to call and book for their children.
Jump to the phones now.
Thank you. A reminder to our reporters on this session, you will have one preliminary and one follow-up question. Up first this afternoon from CHVN, Taylor.
Hi, good afternoon. What's going to be done when parents have split decisions about the vaccine for their younger children?
So when it comes to any healthcare decision, it can be very challenging if parents don't agree, and we would need to have a very careful discussion on a case-by-case basis to determine what's in the best interest of the child. So this is not unique to vaccines. This would be the same thing that would happen if parents disagree about a prescription medication, about a surgery. These discussions have to happen on a case-by-case basis because each family situation is unique and the child's health needs are unique. So we will do that on a case-by-case basis for this as well.
Thanks. And what kind of projections or anticipations do you have for how much of an impact this vaccine for younger children will have on cases both in their age group and Manitoba as a whole?
Yeah, I don't have any numbers in front of me right now, but one of the most reassuring things that I have seen came from some of the school presentations where they showed that when it comes to school-related cases, that for older children, for youth, that cases are very, very low. And that's been really encouraging to see that while in all age groups, they're actually a bit lower than they have been in previous waves, it was dramatically lower for the older kids, which really shows us how well the vaccine is working in that age group, in the children who've been able to get the vaccine. We can just see that play out in the lower number of outbreaks in those grades and the lower number of cases overall. And so we anticipate that the younger ages will be no different. That once we are able to start offering vaccines to this younger age group, that we'll also see a dramatic lowering in the number of cases occurring in that age group. And also we know these children contribute to community spread. And so by lowering the risk of them being infected, we also lower the chance that they can spread to anyone else. The more Manitobans that we can have vaccinated against this virus, the better protected all of us are, and the better chance we have of maintaining a strong functioning acute care system that can support all of our COVID and non-COVID health needs.
From Global News, Joe.
Afternoon. This question is for Dr. Reimer. Just wondering, what's the recommendation for kids who are, maybe straddling both age groups? For example, if you have an 11-year-old now, he or she would get the 5 to 11 vaccine, but in a few months, if they're 12, would they then qualify for a different dose? What do you do in that situation?
That's a great question because that's something I have been hearing from parents who are trying to figure out what decision to make mostly for their 11-year-olds, particularly those who are turning 12 early in the new year. So what we are telling parents is that, it's great to get your kids protected as soon as possible. So if your child's turning 12 in January or February, go ahead and get the pediatric dose for them as soon as you can, as soon as it's approved and NACI recommends it. And then we know that they will then have some layer of protection even from that first dose. The second dose is really important to boost that protection and provide them with an even higher level. But it's better to get the protection sooner than to wait for a higher dose. And for some kids, they might end up with one dose of each type. So if they were 11 at the time when they received dose 1, they'll get the 10 microgram dose, the pediatric dose. But if they're 12 by the time they're up for their second dose, they'll get the adult, the 30 microgram dose of Pfizer. And that also will be helpful to further boost that immune response.
Thank you. And once the rollout begins, schools be able to start loosening COVID-related rules like mask wearing for kids or any other policies that they might have in place right now?
Well, I think that's an ongoing discussion with the Department of Education, where we need to make sure that we are assessing what's going on with the epidemiology and protecting our kids with multiple different mechanisms. Certainly, our goal is to get rid of public health orders as we move forward. We want to have as few of them as possible. And ideally, at some point, we'll be able to get rid of them altogether. But that's a decision that we need to continually evaluate and work with the Department of Education to make the best decision for protecting our kids, whether that's related to masks or distancing or cohorting, or even if they need to move to remote learning. All of those decisions have to happen on an ongoing basis, depending on what we're seeing in our communities.
From the Brandon Sun, Karen.
Good afternoon. I was just wondering if someone could reiterate. I wonder if there was going to be a priority on certain schools, say if they had really high case numbers, because here we've got, 16 in our area with at least one case of COVID, and I think we've got one within the city that has 14 cases so far. So will there be some kind of a specific plan for any high risk areas and schools in them?
Well, I would say if we've learned anything from our first rollout of COVID immunizations in schools, it's that we need to make sure that we're working with the regional health authorities to do individual assessments of what process makes the most sense for their communities. There are certainly times where we would want to prioritize different schools based on uptake in that community, but we also need to recognize that there can be readiness concerns and making sure that we are not waiting on providing the vaccines to schools that are ready to go while we're working through the logistics of other schools that may face more challenges to running a clinic. So each regional health authority is going to connect with the schools that they usually work with and determine what the priority would be for that community and make sure that they're scheduling those clinics in appropriately. And right now, because we don't have any dates finalized for when we expect to receive the vaccine, the regional health authorities are not able to finalize any of that planning as of yet. But as soon as those dates are finalized, they'll be meeting with the schools and the school divisions to start to plan that out in more detail.
Okay. And I think the other question was answered there 2 questions ago in regards to things like loosening of masks. And but will there be anything such as a vaccine passport from now on? Just to clarify, I know that was discussed this morning, but.
So kids will be able to get the vaccine card just like anybody else is able to get the vaccine card or the QR code. We don't have any immediate plans to change the public health orders to require anything for this age group. But of course, as Dr. Roussin would say, nothing is off the table, and that's certainly something that he'll be looking at with the public health team in the future. But no imminent plans to change any requirements for this age group, but they will be able to access the card and the QR code.
Okay, thank you.
From CJOB, Skylar.
Hi there. Thanks for your time, folks. Obviously, there are quite a few kids in Manitoba who are either positive right now for COVID or, recently just finished their infectious period. Can you reiterate that timeline post-infection for kids to get their first dose pending approval? Is it still 3 months?
So we use the 3-month interval after infection in the initial rollout of the vaccine, mostly to preserve vaccine for people who had no protection at all. So when we had such a small supply of vaccine, and we know that most people are likely immune for some period of time after an infection, we wanted to ensure that the small supply went to people who had no protection rather than people who had some protection. And that's the main reason for that 3-month delay, which we stopped doing once our supply became more robust. So right now, the only requirement would be that any individual, child or adult, has recovered from their illness. So we don't want them coming to our vaccine clinic while infectious and putting anyone else in that clinic at risk. But they're not required to wait any specific amount of time after they've recovered before they would be able to get that vaccine.
Great. I appreciate you clearing that up. I also saw data from Ontario that showed quite a difference between certain combos of vaccines and their resistance to breakthrough infections. I think that data showed that an AstraZeneca vaccine followed by one of the mRNA shots was the most, the most effective at preventing that. Does Manitoba have any similar data?
So we're a relatively small province. We definitely do have the same data, but it does make it a bit more difficult to interpret when our numbers are so much lower than other provinces, just based on the size of our population. However, what we've seen from many other jurisdictions is that the mRNA vaccines, whether used in combination or 2 doses of the same one, provide excellent protection for a long period of time against severe outcomes, unless somebody has a specific reason that they might not be well protected, such as if they're over the age of 80 or have multiple health conditions. With AstraZeneca, we have seen that immunity does seem to decrease faster than with the mRNA vaccines, which is one of the reasons that we recommend that people who received 2 doses of AstraZeneca should get a booster with an mRNA dose to ensure that they have brought their immune response back up to where it may have started and be more similar to those people who received mRNA vaccines.
From CBC Radio Canada, Alexia.
Good afternoon, everyone. I was wondering, are you planning on offering information sessions or distributing pamphlets in school for people who may not be willing to check their Protect MD portal or talk to their health providers?
We have multiple plans for rolling out information. So we will be updating our website. We'll be working with our physician and pharmacist partners to ensure that they have access to information that they can provide to their patients. We will have fact sheets that are available and will be provided at vaccine clinics. And then, the minister also spoke about the new vaccine campaign that's going to be aimed at children as well, to make sure that they have information that is in language and colors that is something that they can understand and be interested in. So we plan to create opportunities for multiple different types of information to be available to Manitobans. That way, each Manitoban can have information that's the most relevant to their needs.
Thank you. Although still regarding school, did you hear about bullying or any incident between younger Manitobans regarding their vaccination status? And if so, are you planning on sending any educational material to school staff explaining maybe how to deal and how to prevent those situations?
Sorry, did you say bullying? Was that what the question was about?
Yeah. Did you hear any situation like that occurring regarding vaccination status for kids' vaccination status?
I have not been made aware of any situations like that. I'm not sure if the Premier or the Minister have, but certainly that's something that the Department of Education would take very seriously. And I know that they already have work that they do on anti-bullying campaigns that that would apply for this situation as well. But I'll defer to the Premier or the Minister if they might have more knowledge about this one.
Yeah, I would just say that we could follow up. I'm not aware of anything personally about that, but certainly we can defer that to the Minister of Education and get more information on that. That would obviously be very concerning to us. We don't put up with any kind of bullying whatsoever at all on any subject at all. So, but we'll certainly find that out for you.
From CBC Manitoba, Alana.
Premier Stephenson, we've known about the mounting surgery backlog for a long time, and it's about to get worse with the cancellation of surgery starting this Friday. If this is the priority you say it is, why not address this now rather than waiting to announce something after the throne speech next week?
Well, I will defer to the Minister of Health with respect to some of the more details on that, the detail-oriented side of that. But I will say that this is a priority. I mentioned it in my inaugural address. There is work that is going on right now as we speak to address these backlogs. I know I've been in meetings today along with the Minister of Health as well on this very subject, and I know that she is working diligently along with the department and with officials in the healthcare system to ensure that this is top of mind and that we are dealing with this. And so, Minister, I don't know if you want to add anything to that.
Yeah, so I do want to add to that. Thank you, Madam Premier. So this is a priority for our government and for our Premier, and we have been acting in terms of addressing the surgical and diagnostic backlog. So the request for supply arrangement that closed on October, I think it was the 27th or the 21st, that was the fifth supply arrangement that was requested. And currently, I've shared this number before. I do want to give you some more details, though, that the current forecast for 21-22 spending in terms of the $50 million we have invested as a government for the surgical and diagnostic backlog is $13.7 million, and $8.1 million committed through the request for supply arrangement for surgery and diagnostics, and a further $5.6 million in service delivery organization spending for priority procedures. But what I think is important to note is, in terms of your question, is that we have been taking steps. So the $8.1 million in requests for supply arrangement agreement for procedures have been procured to date, include echocardiography, cataracts, outpatient spine procedures, adult ENT, so ear, nose, and throat, and general surgery, and pediatric dental ENT and general surgery. In terms of the $5.6 million in service delivery organization spending, that's being used for additional hips, knees, cataracts, and diagnostics. So we are taking now, even before we announce the surgical and diagnostic backlog task force to address our surgeries and ensure Manitobans get the care that they need.
Okay, and this is a question for Dr. Reimer. Can you tell me what the status is of the third dose campaign in personal care homes? Is it complete at this point? And if not, when is the new target date for it to be complete?
At this time, all personal care homes have offered a third dose to the residents who would like a third dose. So I believe that we have completed the campaign as far as ensuring that everyone has been offered a third dose, but there will be ongoing work for new admissions to personal care homes, as well as offering the vaccine on an ongoing basis to people who may not have decided to take them up on the offer when it was initially done. And one of the things that we've done to help ensure this remains available is that the vaccines are provided by the staff at the personal care homes in most facilities, which means that they can have it on site and available whenever it makes the most sense for their facility to offer to the residents, rather than having to wait for a public health team to come and offer the vaccine for those residents. Yeah, it's been quite successful. We've seen a lot of great uptake from the personal care home residents so far, and hope to see those numbers continue to go up over time.
From City News, Mike.
Hey, good afternoon, everyone. My first question is for Dr. Joss Reimer. This is probably a premature question, but should we expect a third dose being required for those 5 to 11 and that longer wait between the third dose and the first and second doses if it is required?
That's really hard to know at this stage. We're trying to gather as much information as we can, but obviously we don't have that type of long-term information about waning immunity for this age group because the trials have only just completed in this age group, and they wouldn't yet be experiencing any waning of their immunity. But what we're seeing from adults is that, over a 6-month period, you do see some reduction of protection against mild infection. And while that's not a problem for most people, it certainly can be in certain circumstances. For example, if you're a healthcare provider and you work on a hospital ward, even mild illness can be quite difficult to manage and to continue to provide adequate services in that ward if many of the staff members are off sick, and certainly also concerning if the staff members are a source of infection for vulnerable patients. So likewise with the younger kids, it's possible that over time we may see a decrease in their protection against mild infection. And for some children that may not be a major concern, but for others who have themselves medical concerns or are close contacts of people who experience a lot of vulnerability to severe outcomes from COVID, it might be important for those kids to get a boost to their immune response over time. But we'll really have to wait and see over the coming months whether children experience the same decrease in immune response against the mild infection that we saw with adults.
Thank you for that answer, Doctor. My second question is for Premier Stephenson, bit of a topic change. The Manitoba NDPs are calling for an independent expert-led inquiry into the PC handling of the pandemic. Are you aware of this call, and will you look into setting it up and supporting an inquiry?
Yeah, I'm aware of it. It was brought to my attention just prior to coming into the news conference. And what I would say is that, I mean, we're in a fourth wave right now. We need to ensure that we're expending our resources and our time, effort, and energy to ensuring that we're focusing on the safety and health of Manitobans. So that will be our focus, and we won't, stray from that focus.
We are checking if CKDM is still on our session. If not, we return to the news conference theater.
Yet another topic change. You said today that the province will not be appealing the carbon price ruling from the federal court. Are negotiations going well with Ottawa? And is Manitoba still insisting on some sort of discount to recognize the money spent on hydro?
Yeah, very, very good question, Steve, and thanks for that. And I think, this is an opportunity, I think, for us to press reset with the federal government and have more of a collaborative relationship with them. I did have a very productive conversation with the Prime Minister a week ago Friday and discussed many of these issues that are of concern to Manitobans. And obviously, and we did have our COF meeting on Monday and an FMM meeting yesterday. Then the ruling obviously has come out. We'll accept that. And I think that there's a better way moving forward through negotiations. So we will continue through our staff to negotiate that, but we need to obviously recognize Manitoba's clean green energy as a part of that. But I'm from the conversations that I've had so far with the Prime Minister, I'm cautiously optimistic that we'll be able to come to some deal that will be obviously in the best interest of Manitobans, and I certainly wouldn't back down. I will always put the best interest of Manitoba at heart.
I mean, it's the same federal government that insisted on the backstop and did not want to give a discount for the investments made into hydro, et cetera. So has anything changed on their side?
Well, I think that those discussions are ongoing. I'm not going to reveal that right now, but I think there's a recognition that maybe a change in tone and how we're going to be dealing with things moving forward. And we did have our climate and green plan before. There's other provinces that were able to move forward with their plans and Manitoba wasn't, and that was unfortunate, and it went the route that it did. But again, I'm cautiously optimistic that we should be able to come to some sort of agreement going forward. Again, I will always put the best interest of Manitoba at heart and ensure that those issues are addressed.
Does that mean you're going to have to agree to the federal backstop level?
No, I think that what this does is it offers us an opportunity to have these discussions at the negotiation table rather than through the courts.
Premier, union, the Manitoba Faculty Association Union has been stalking you. They've been going to your constituency. They've been demonstrating outside here. Why won't you meet with them? You've been listening to all sorts of people. You've been talking about listening and listening. So why won't you sit down and listen to them?
I think what they've also been saying is that they don't want us to intervene in this as well. And so I think that would be inappropriate at this stage. I think that we need to allow them to have those discussions with the employer. That's the appropriate way to handle this, and we'll continue to follow that process.
And you said that vaccines are our way out of this pandemic. So why won't you insist that members of your caucus and your cabinet are fully vaccinated?
Yeah, we're having those discussions. I'm in the process right now of meeting with our individual caucus and cabinet members about that. I know we're also working towards the throne speech coming up, and we're having those discussions with the speaker and seeing, how can we maybe have some people come to the gallery to the extent that people are excited about the throne speech and want to come and see it. I know it might not be as exciting as going to a Jets game or a football game, but it's still going to be exciting, I think. And so we're having those discussions with the speaker to see what that would look like and what that would mean. I know for right now, you are required to be vaccinated in the chamber, but we'll continue to have those discussions moving forward, and I will have those discussions with my individual caucus colleagues as well.
So you have to show proof of vaccination to get into Parliament. Winnipeg City Council has recently brought in a policy that you have to be fully vaccinated to get into the council building. Why not do it for the Manitoba Legislative Building?
Well, we're considering that.
For the whole building?
Yes. Yeah.
We might hear it in the throne speech.
We'll see. I mean, I'm having those. We're in discussions with the Speaker's office. I want to respect that process as well. There's various. the chamber and the committee rooms and so on are under her purview. So I want to respect that. But certainly, these are things that are definitely on the table.
And that would apply to all MLAs.
That would apply to anyone coming into the building. Yeah.
Thanks. One more for Dr. Reimer, the last one here. Okay, guys. So in the data that the province put out today, perceived lack of testing and long-term side effects are the reasons why parents don't want to get their children vaccinated. So what is the lower risk? If a child gets infected and they have, a lower risk of getting severe outcome, or do they have a lower risk of getting a side effect from the vaccine? Can you compare the two?
So as I said before, we haven't seen the submission to Health Canada, so most of my comments are based on the American submission to the FDA. I assume that the submission to Canada is similar, but do want to make sure that we caveat that this is right now based on American data. But the FDA did an analysis to compare the risks of the vaccine to the benefits of the vaccine in protecting against COVID for this age group, and found that when they looked at what they've been seeing with COVID infections throughout this pandemic, that children were at higher risk if they chose not to be vaccinated than if they were vaccinated. So those who were 5 to 11 had a higher risk of ending up in the hospital if they chose not to be vaccinated than a risk of ending up in the hospital related to the vaccine itself. That's not to say that it's zero risk. We recognize that we've seen myocarditis occurring in youth and young adults, but so far we haven't seen any cases in this age group. And even if we do, as I mentioned before, most of those cases are mild and resolve completely with anti-inflammatory medications, things like Advil. And so we anticipate that it would be a similar data set that informed Health Canada's decision to approve the vaccine, and that they wouldn't move forward unless they felt that the risks of the vaccine were reasonable in comparison to the benefits.